Welcome, guys. In today's session, I'll be discussing the anatomical snuffbox, and we look at some anatomical aspects which I feel are of importance regarding the anatomical snuffbox. Welcome all. My name is Wallace Munyidi, and I'm the Daktari. Now, so the objectives are as follows. I'll do an introduction to what is the anatomical snuffbox, the borders, the contents of this anatomical snuffbox, and finish by discussing the clinical correlates. Now, introduction. The anatomical snuffbox, which is also known as the radial fossa, is a triangular depression found on the lateral side of the wrist. It is located at the level of the carpal bones, to be specific, scaphoid and trapezium, and best seen when the thumb is extended. I'll show you that. Okay. In the past, why is it known as a snuffbox? This is the reason. In the past, this depression was used to hold a snuff, which was simply tobacco which has been grounded. So then it was inhaled into the nose. Hence, it was given the name snuffbox. Okay. So what are the boundaries of this anatomical snuffbox? Now, it is triangular in shape. So it is triangular in shape. You need to know that. So it has 3 borders, a floor, and a roof. Now, the ulnar border, which is also the medial border, is formed by the tendon of extensor pollicis longus. Okay, extensor pollicis longus. Let me take a pen. Extensor pollicis longus, EPL. Okay, then the radial border, which is the lateral border, is formed by the 2 tendons. One, extensor pollicis brevis, okay, and abductor pollicis longus. Now, this is the longus, and now the abductor pollicis brevis is located in the vena group of muscles, but it does not form a border in the anatomical snuffbox. Please remember that it is the abductor pollicis longus which forms the lateral border of the anatomical snuffbox. Now, what about the base or the proximal border? Is formed by the radiosteroid process or the steroid process of radius. Okay. Then the floor is formed by 2 carpal bones. Proximally, you have your scaphoid, and distally, you have your trapezoid. Also, you might find other text which might include the base of the first metacarpal as part of the floor of the anatomical snuffbox. Now, the roof is by the skin and the fascia. Okay, so superficial fascia and the deep fascia, and the deep fascia of that region is modified to form the extensor retinaculum. Okay, so we have some contents within the superficial fascia, which we will discuss later. So, in fact, this is my picture over here. So, let me take back this point. You can see this depression here. So, in the past, tobacco would be placed there, the grounded tobacco, then it would be sniffed. So, it's the anatomical snuffbox. Okay, you can see my thumb over here is extended, so that you can see how prominent this tendon is. So which tendon is that? That's my extensor pollicis longus, and that is my medial border. Okay, please remember, ulnar will be towards that side. So this border will be closer to ulnar. So it's the ulnar border or the medial border. So it is formed by that tendon of extensor pollicis longus tendon over there. Okay, so you can see it is proceeding up to here, and it is inserting somewhere here. That is the base of the distal phalanx of the thumb. Okay, and this is my lateral border or the radial border. And over here, if I can take a pen, you can see, in fact, 2 tendons. We have one which is coming up to that point, and another one will continue up to somewhere there. Okay, so this short one inserting to the base of the first metacarpal, that is my abductor pollicis longus. Then the other one proceeding to the base of the proximal phalanx of the thumb, that's my extensor pollicis brevis. So this triangular space, roughly that, and over here where I pointed by the black arrow, that is my radiosteroid process. So you can see that depression there. That triangular outline outlines the anatomical snuffbox, and it is simply this region here. Okay, it's this. Now this is a diagrammatic representation of the same. It is that. Okay, so what will be within my anatomical snuffbox over here? Okay, so this is also a diagrammatic representation of the same. This is the ulnar border or the medial border, and this here is the radial border or the lateral border formed by the two tendons of extensor pollicis brevis and abductor pollicis longus. Okay, then the ulnar border or the medial border is formed by extensor pollicis longus. Yeah, and the proximal border or the base will be formed by the radiosteroid process. Now, what are the contents of the anatomical snuffbox? One, radio artery. Okay. Two, we have a branch of the radial nerve. Which branch? The superficial branch. Okay. Then we have the cephalic vein. As the cephalic veins, vein, as the cephalic vein originates from there, as it arises from the dorsovenous network of the hand. Okay. It usually crosses the anatomical snuffbox, and then it will travel up the anterolateral aspect of the forearm to the arm, and finally it will move to it will go to the dectopectoral groove, pierce the skin, and also have to pierce the clavipectoral fascia before draining into the axillary vein. Okay, so and there they are. Now the radial artery, as it crosses the floor, remember the floor is formed by the scaphoid bone and the trapezium. Scaphoid proximally, trapezium distally. Okay, so it crosses on top of these bones. Okay, then it will pass, after crossing the floor, it will pass between the two heads of the first dorsal interosseous muscle, and after crossing those two heads of the first dorsal interosseous, it gives off the two branches, one to the thumb, the princeps pollicis artery, and one to the radial side of the index finger. So it's an artery to the radial side of the index finger. So it is known as the arteria radialis indicis. Then it will continue to form the deep palmar arch. Okay. And clinical correlates. One, remember the floor is formed by the scaphoid bone. So fractures of the scaphoid bone can arise. Okay. So especially if one has a blow to the wrist, if you have especially a fall on an outstretched hand. Okay. In these cases, how it presents, there will be a tenderness in the anatomical snuffbox. Okay. And fracture, remember scaphoid has retrograde pattern of blood supply. So if you have fracture, especially of the neck, this will disrupt the blood supply to the proximal portion of the bone, and this will lead to, if there is failure of revascularization, a vascular necrosis will ensue. Okay, a vascular necrosis will take place. So if one has tenderness over the anatomical snuffbox, you should be concerned about the fractures of the scaphoid. And in such situations, the best thing to do is to immobilize that wrist, so that you have a reunion of the fractured portions of the scaphoid. Also, if you could allow me to go back. Okay, so these two tendons over here forming the radial border of the anatomical snuffbox, that is the tendon of abductor pollicis longus and extensor pollicis brevis. Remember, they are in the first, they form the first, in the first, that in the extensor compartment, they form the first compartment. Okay, so they are in the first group. Okay, so they are somehow, we have an extensor, we have some fascia of arcing those tendons, so to form what is known as a fibro-osseous canal or a tunnel. So if you have overuse of the thumb, there is likelihood that those tendons can become inflamed. Okay, so if you have inflammation of those two tendons, that leads to a condition known as the Decavins tenosynovitis. Okay, Decavins tenosynovitis. Okay, so if you want to do an injection, a steroid injection to somehow like treat the Decavins tenosynovitis, you inject the needle. The needle should be should be directed towards those two tendons, not don't inject extensor pollicis longus. Okay, so I think those are enough clinical correlates. And thank you for attention and good luck and best wishes. Thank you.